Okay, y'all, this is a video giving a more thorough breakdown on my surgery processes that I need to have done. I want to compile it all in one long half-hour video. Oh, sorry, y'all, let me kick my darn on tripod. But I mentioned it in my darn on live stream that I recently did about a month ago. But I was a little bit scatterbrained all over the place. I was angry and irritated with my life situation and everything going on. I was upset. It was on my birthday, and I naturally don't normally celebrate my birthday. I was going through a whole array of emotions. Also, my uncle died on my birthday last year while I was simultaneously battling COVID myself. So it was like, I was just remembering a whole lot of stuff from Amazon I was working at last year, battling COVID, to losing my great uncle, and then the situation with the demon. So I'm trying to darn give y'all all of that in conjunction with me darn talking about my surgeries. All the surgery talk got lost in the sauce, honey. But yeah, my goal is for April, no later than the beginning of May of this year, I will undergo a tracheal shave. So I will be getting rid of this once and for all. The recovery process is about 2 weeks. And of course, with most surgeries, avoid salty foods, avoid foods that, cause heavy mucus buildup. So fried foods, white breads, sugars, and I'm doing good on sugar. I'm drastically cut down my sugar intake. I've been, going back and forth with veganism a lot more, as y'all can tell. That's why I've been getting into the cooking videos, doing healthy cooking. So when I have to, have no choice but to eat healthier during my recovery process, it won't be a struggle for me because I've already have gotten used to it over a course of time, if that makes sense. So that is that. So the cost of this, and this is where it gets convoluted because I'm unsure. And then, why is United Healthcare? I can't never get an American bitch on the phone. There's always somebody from China, and there's a language barrier. But I think she said my insurance covers it under gender dysphoria. What's the terminology? It's not within my like I'm not going to my primary care physician. So outside of my network, out of network coverage, I would have to come up with 15% of the cost. Now, this can cost as much as $4,000. So 15% of that is $600. Now, if that is indeed the case, if the tracheal shave, and I got to once again get confirmation, because once again she took like 20 some minutes to give me that answer. And then she went through and broke down the whole history of what could be included, what could not be included. She went on to talk about the facial feminization may not be included, all this, the liposuction. I was like, ma'am, didn't nobody ask? And lipo where, honey? Girl, hold on, don't let me get, girl, lipo where? What, honey, this waist is already snatched, baby. The waist is darn going sitting pretty, honey. The arms are lean, honey. Matter of fact, a little bit too lean for my liking. I would like to put on a little bit of muscle on the arms. The ass, we don't want to go nowhere, honey. The thighs are darn going tone like Serena. Where is we doing lipo, honey? Didn't nobody ask you for no lipo. I asked you about the darn going the breasts and the trachea. That's all. Nothing more, nothing less. She go in and talking about laser hair removal and all this, that, and the third for the bottom. I was like, once again, why can't y'all do it for the face? That's what most people going to see. Y'all talking about darn, y'all really treat body dysmorphia as a darn thing. Honey, the first thing people see on a trans woman is the damn face. Hell, if anything is darn cosmetic, it would be the darn private area, because only darn select people get to see the hoo-ha area. But see, their justification is it makes it easier for the darn item to get zip flipped and reversed if it ain't no hair on it. Child boo. Why can't there be a such thing as cosmetic insurance? And I know there's a such thing as care credit and all of that, but Lord, it got its darn downsides too. Although I might have to, I might have to do some care credit on that because it's like, honey, who the hell got? I ain't got that type of money. Now the $600 is reasonable if that is indeed the case. If I can get this for $600, I've already scoped out a doctor. I'm going to stay in North Carolina for that one. Number one, because my insurance don't allow me to go outside the state of North Carolina. So that's another thing. Now, that's where the issue comes in. Now, I found 2 people that I feel confident with that has done a plethora of transgender breast augmentations that are very skilled in what they do. And they have specifically done it on black trans women. Once again, our body frames are different than, you know, because usually when we see the transitions, it's usually the little petite Asian girl. They got a little 250 cc's. I was like, now what about a bitch like me that needs maybe more like 400 cc's? Like, I need to see what your results is for a girl that needs a little bit more, honey. So I found 2 people, Dr. George, and then surprisingly, he's down in Texas. So by the end of this year, I might be in Oh God. But see that one's gonna be a little bit lenient. I don't know. I might be in Texas for 2 weeks at the end of the year. Y'all know how anti-trans Texas is. Now this doctor is freaking phenomenal. He works with the girls. Hell, he is one of the girls. He's a Latin man. And it wouldn't be, and of course, you know, I'm sure they got packages where they comp hotel costs and all that. They wrap that into the cost of the insurance, and I can split that up with care credit and all that. I got to see what I would naturally qualify for in care credit. Like, because my breast implants is going to cost me as much as $10,000. I originally wanted to get saline implants through the underarm because I thought that was the most safest option for me. I have now since learned that that is not a viable option for me after looking into it more extensively. Number one, they talked about the bacteria causing a more higher risk of infection and capsular contraction. Also, in trans women, it can cause the boobs to go to the side when you lay down. Like, they good when you're up, but if you got it through the underarms, soon as you lay down, your boob go this way and this way. I'm not trying to have that. Another thing is, if you go up underneath the muscle, I'm just going to show my stomach, y'all. That's it. So with me, as y'all can tell, I'm a Fitzpatrick number 5. So if they go underneath the muscle, what's going to happen is I'm going to be more prone to post-inflammatory hyperpigmentation, where it's going to show a darkness underneath my boobs or whatnot. Now, you do have fractorial laser for that, which is an added cost, which is solely cosmetic, which will mean I would have to come out of pocket for that one. Now, granted, I might be able to put that on the care credit too. I don't know. Because care credit actually does cover cosmetic procedures. But fractorial laser is hit and miss when it comes to people of color. And I say people of color because even Asian people, indigenous people, dark-skinned Indians have a hard time actually getting fractorial laser. So you thinking about somebody that's black, that's on the darker end of the spectrum, that is like a shade 430 and darn on Fenty, getting darn on fractorial laser. No. Hence why I want them to go through the area. Once I learned about the areola process and how the areola is an area of the skin that is not prone to scabbing up like that, I've learned about the 5-stitch technique that makes the darn healing process even more streamlined. If a doctor knows how to go in using the funnel bag, it reduces the chances of capsular contraction. Also, going through the boobs make it less prone, because capsular contraction goes from either down here above the muscle or throughout this way, is not likely for it to come out that way. It's impossible for it to try to push out that way. So, but also with trans women, we have to worry about the pectoral muscle activating a little bit much. So it has to be done in such a way where, you know, it takes our pectoral muscle in mind, where it don't look overly fat. Now, some trans girls go for that look where you get the perfect, you know, roundness above. Me, I'm somewhat in between. I don't want the teardrop because the teardrop has a high rate of being able to turn, and if it turns, it's more noticeable than a rounded implant. So I was going to get rounded saline, because if it busts, it would darn going to absorb in my system. I was scared of what would possibly happen with the silicone because I suffer from Crohn's disease, and I ain't want my, you know, Crohn's disease to be exacerbated. But I'm now learning that breast implant illness is not a thing with the new modernized gummy bear implants. And when they break up, it doesn't actually hit the bloodstream. It doesn't stick to your arteries and stuff like the implants in the past. And they only cost maybe like $1,000 more on average. So now knowing that the silicone implants are way more realistic, they what can I say? Way more realistic, has less you know, material on them. So the grafting is less, which means less fat for them to pull, which is another procedure I'm going to have done, because once again, as y'all can tell, I'm going to show y'all my stomach one more time. DivaWuan's does not have no fat on my stomach like that. As y'all can tell, I got a pretty good muscular frame. Now, I'm not abs, you know, my abs ain't sculpted, but I don't carry, like, I don't got no love handles or none of that for them to take fat off of. The only area they can take from is the inner thigh. So they're going to take enough from the inner thigh to cover up any potential grafting up here. And yeah, all of that is going to run me anywhere from like $10,000 to $12,000. Recovery process on that one is going to take me roughly 2 weeks before I'll be able to do light exercising, like being on the treadmill. I also got to move regularly to prevent myself from getting blood clots. After a month, I should be able to do some light upper body exercise, but for the first 2 weeks, I'm not even going to be able to lift my hands above my head. So I can't even shampoo my own hair for the first 2 weeks. Hence why it would be nice if I can get the hair surgery first, because then I can cut off all this hair and I won't have no hair to really deal with. It's easier for me to go 2 weeks without having to worry about my hair if I don't have no hair. So yeah, that's where we're at with all the surgeries, y'all. So if everything goes right, I want to get the tracheal shave, preferably middle to late April. Then we follow up with the hair transplant in June. Now, hair transplant in June, I am going to go to, Lord, I never have they darn video queued up, but there is a place, they have 2 locations. They have one in Florida and they have one in Maryland. I think I might go to the one in Maryland location. Number one, because it would be easier for me to come from Maryland and come straight back home to North Carolina, and then come back to Maryland in 2 weeks to do the, you know, for them to take out the stitches and all that, and it won't be so costly, you know, as far as airplane tickets and stuff is concerned. Because once again, I have to fly first class because of the fact that I can't risk nobody being beside me, and I just had major surgery. So I need, you know, ample room by myself. So I'm going to have a first class ticket, and it would be cheaper, even though I really wouldn't prefer Maryland, honey. But I have no choice to go to Maryland. I was thinking Florida because I was like, well, shit, I know several people down in Florida, honey. I can darn visit this person. I can visit this person. Now, they going to have to get over the fact that DivaWuan's is looking like Frankenstein down here for the 2 weeks, honey. I can't even put a wig on for like the first month and some change. Hence why I want to get that ish done early on as opposed to later on in the year, child. Because I ain't trying to go through too much swelling on my body and all of that with trying to get stuff. So I'm trying to space the stuff out properly. And like I said, every time I do one of these surgeries, I have to temporarily adjust my diet to cut out certain foods. And it's like, yeah, I'm definitely ain't about to doggone go through the stress of, you know, doing a mommy makeover. Bitch, I ain't nobody's mama, honey. So it's like we can afford to space this ish out, honey. Especially on DivaWuan's budget, honey. Even when DivaWuan, because once again, when I get to working, I have to work to doggone fund all this. So it's like, yeah, insurance is going to cover some aspects such as possible trachea shave, but everything else is on me, honey. The hair transplant is on me. The breast implants is on me. Hell, I would love to have a little sculpture done too, but it's like, now that'd be doing too much. I can afford to go without the sculpture. DivaWuan, you already got a fat ass, girl. You can survive with the hip dips for another year. Now with me, the sculpture is a procedure to enhance the collagen in your behind. It makes natural collagen in your body over a course of months. Hence why they space it out and you get several shots over a course of months. So in between my surgeries, I would love to have the sculpture service done. That can cost as much as $3,000. But it's good for candidates like me that's not looking to get a BBL type of booty. Like I said, DivaWuan already got booty, honey. If you know, go check out my Twitter for every once in a blue moon I post an ass shot so y'all get to see what Diva's working with. But yeah, my issue is I need to fill in hip dips and I need a little bit of a lift to my booty. That's it. I don't need volume. I just need a little lift and a little bit of feel. That's what I need. And that's what sculpture comes in. Now, if you need something more than sculpture, you trying to go from a flat behind to a Nicki Minaj, yeah, you're going to have to get some implants or something of that caliber. Or if you got a stomach, if you're an apple-shaped type of girl, go ahead and take it off from your stomach, do the lipo, and they can use the fat from the lipo to go on ahead and inject in the booty. But if you're a girl like me that's, you know, relatively fit, and the only darn area you got is a little bit of thigh fat, yeah, the only other option for you is going to be the implants. Honey, we ain't getting no implants downstairs, honey. It's going to be natural downstairs. Now, up here, it's going to be genetically modified. But yeah, y'all, that is my time frame and my schedule. Hopefully, I will be able to stick to it. It's all contingent on, you know, the way that this year goes as far as the jobs and me flipping my money and all that. Hopefully, I'll be able to have myself set up in such a way where I can afford the recovery time. Because my problem is I don't want to be stuck at a job while doing these things. I want to only be at a job for like a couple months. Enough, and you know, time is passing by like that. Like, it's already February. So now it's like I really only got 2 months to really stack up some coins. So it's like I need a job like yesterday on that end. But yeah, once I get the ball rolling on that, and then I flip that money, start doing clients here and there. Because see, now with the trachea shave, I only need like 2 days of rest, and I can actually go back to work. And it doesn't affect my arms and stuff. It just affects my voice. So I will still be able to work, you know, with clients and stuff if I get back to doing aesthetics. And that's why I'm pacing the surgeries out like this, because, you know, I do the simple stuff first where I can still work, and then by the time I get to the ones where I need the actual downtime, like the hair transplant, and even with the hair transplant, theoretically, I could work or whatnot. I just don't want nobody looking at me being doggone be like, oh, because once again, I can't cover up the doggone spot or nothing for like 2 weeks. So I ain't trying to scare none of the doggone clients coming in trying to give you a facial and I'm all up in your face looking like doggone Frank. You know, that's not the damn tea, honey. Now, maybe if I was getting the shit done in October, you know, I could pass that shit off as Halloween. Honey, I'm your sexy mama. I'm your sexy. Honey, I got my... I'm serious. If I had the hair transplant done in October, I could get away with that shit. And they're gonna say, honey, I'm dressed as a sexy mama, honey. But no, I want to have this shit done in the month of June, honey. Because by the time October come around, honey, I want to have an old nasty piece of 30-inch darn platinum hair. I want to be Storm for Halloween, honey. Since they still don't want to give us a chocolate Storm. They entertaining now trying to talk about Chloe Bailey for the next Storm. I was like, oh, y'all just ain't going to never give her a dark-skinned bitch Storm. Y'all ain't going to give Nefessa Williams, a Keke Palmer, a Kelly Rowland, a nobody chocolate, Tiana Taylor, nobody chocolate Storm. Honey, I guess I'll be goddamn Storm for the darn October, honey. So coming this fall, honey, DivaWuan's will be the infamous Storm. And so for me to be the infamous Storm, honey, I need to be able to wear a wig, honey. I ain't trying, but child, yeah, if I had to, I would have darn wrap myself up as a mommy, honey, for the month of October. But yeah, like I said, we trying to get this done before then, so yeah, that's why that's going to be a no-go. Because the implants are going to be November to December. Preferably November, because that gives me time to really be healed up by my birthday come January. Now, if I go down to Texas, I can get in an Airbnb in Texas. But it's like, ugh, I don't know. Then there's another doctor. And ironically, I think they located in Maryland too. Honey, Maryland just got it going on. No, they located in California. Dr. Barrett Plastic Surgery. And let me see if I can include a clip of him up and through here or whatnot, working on a trans patient. Warning, warning, warning. This video is going to have some images, honey. So, matter of fact, I will edit this video to have that, you know, at the very beginning. So, for the people who have children in the room or people who might not want to see no tatas, y'all, you know, this is the time to click off the video. But yeah, this is a transgender around my build or whatnot. It's a little bit more muscular than I am. You know, beautiful chocolate complexion, getting the darn procedure done. So as y'all seen from that video, he does excellent. He got a plethora of videos with the girls, getting all different levels of, you know, implants, explaining the procedure thoroughly, you know, comparing them and everything, going in with the funnels thing as opposed to pushing the implant in, which reduces capsular contraction by over 50%. Going through the areola, that way it reduces scarring, and you're able to easily conceal said area, as opposed to if it's underneath the boob and you're somebody my complexion, it's like the scar is going to show up, you know, noticeable. Like if I was Lupita Nyong'o's complexion, I probably wouldn't have much to worry about because the scar would blend in with my skin tone. But I'm a chocolate girl that's on the lighter end of the spectrum. I'm like a light milk chocolatey Reese's Pieces color. So if you're like my complexion and lighter, you run the risk of the scar showing up, and it's like, I ain't trying to have no visible scars, honey. So let it be around the areola. And besides, with my areola placement, I might have to have them darn going reposition anyways. So it's like they might as well do all that in one whop, as opposed to giving me multiple scars. Just give me one right here that easily blends in, while repositioning the darn areolas in a good place. Also, I don't have to risk, you know, with going through the areola, there's a lot less of a chance of the nipples going like, real. For anybody who's been on Freak Twitter and y'all have seen the girls where the nipples point up, that's because the boobs, you know, I think they said something about the capsular contraction when the boobs drop down, it forces the skin to flip up, and by default your nipples end up getting pointed to the ceiling. I ain't trying to have, you know, I ain't trying to have my doggone titties doggone compete with doggone old girl's legs from Love and Hip Hop. You know, Rashida, legs to the moon. I ain't trying to have my titties pointing to the moon, honey. I don't need my tits darn gonna point to the North Star. I need you to be straight in center, honey. I need you to be at attention, honey. I need you to be straight this way. I don't need you going to the side. I don't need y'all to be going separate paths. I need y'all to be like this, not going up like this, not one doing this, not. Yeah, we need y'all like this, honey. So, yeah, y'all, that is all my surgery breakdown in darn going detail with videos, giving y'all a more visual demonstration of what I'm trying to do. So, y'all wish me luck on this journey. Y'all have any advice, any motivational words of encouragement, honey, I welcome it all. Leave it down in the comments box below. Feel free to share and subscribe, and I will see y'all soon with more videos. Good night, or good morning as per usual. I'll be so happy when this demon go back to second shift so I can start doing videos in the daytime. Honey, it's like 2 o'clock in the morning. Good morning and good night.